Welcome to the Movement PT COFFEECAST, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations. What's going on, guys? Welcome back to the Movement PT COFFEECAST. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Well, Dalton, doing pretty good, but I think we got to be honest about what just happened with our guests. What do you think?
Yeah, so sometimes you start to record a podcast and then things go downhill. A dog comes in.
Another beautifully bearded friend.
Comes in and knocks over your coffee. And you just have to pause the podcast, actually restart the podcast totally, and adapt. So That's what we did.
It's all about adaptability. That's what we're trying to be about, right?
Yeah, for sure. So, and here we are, guys. Now we're going to go at it. So basically, we're back at it with another episode. It's been a while since me and Will have recorded a podcast. We bunched together a couple episodes, like the one we did with Jared and Danny Lear. We did those in a short period of time, and now it's been probably about 2 weeks or so since we recorded a podcast, so we wanted to hop on. It's just going to be us today. Our goal with this podcast is kind of give you guys a little bit of an update on where we are in our physiotherapy lives. A lot has happened over the last couple months, so we kind of wanted to talk to you guys a little bit about that, and whatever else comes up over our cup of coffee.
Yeah. So speaking of which, we have officially almost recorded 40 podcasts.
Yeah.
And over the course of that time, a lot of coffee has been drank. A lot of guests have been talked to. And I think we just got to take a minute to kind of, just chat about that. And
yeah, so I think this is going to be episode 38, if I'm not mistaken, which is wild. And
so crazy.
And we want to just obviously thank you guys, because if you guys hadn't listened or gave us the support or reached out and told us how much the podcast has helped you in certain ways or certain people that you enjoyed, like, we wouldn't have continued to do it. And selfishly, we've learned so much. And had the opportunity to talk to some people that we honestly never thought we'd have the opportunity to talk to.
Yeah.
People we look up to in the field.
Yeah. Cheers, Dalton.
Yeah. So we'll cheers to that. Cheers, guys, if you guys are listening. We appreciate it. We hope you guys continue to rock with us, and we hope we continue to give you guys a good podcast to listen to. We have some ideas going forward. We're obviously going to continue to keep seeking out some amazing people in the physical therapy field, in the strength and conditioning field. We want to dive into the psychology realm of things and try to get some people on there to talk about that. So if you guys know any guests that we could chat with, send us a message.
Maybe a doctor.
A doctor, that'd be good too. I think just bringing everyone together and having a conversation about the current state of the health profession. I think we're in an interesting area, and we're in a transition period where I think physical therapy in particular can take a big stronghold on the healthcare system. So I'm pumped. I'm pumped to be actually in the field now.
Yeah. Exactly.
Which is crazy to think, but so we graduated in August, and in Canada, you graduate and you become a physical therapy resident.
What have you been doing since kind of graduation?
What have I been doing?
Yeah, what have you kind of started up and...
Yeah, so I mean, we graduated in August, and then we already wrote our written board exam, which allows us to practice as a physical therapy resident, and then in Canada, we also have to pass practical board exam, which we're gearing up for in a month time from now.
Yeah.
Which will then, once we pass that, we'll be officially licensed physical therapist.
Yeah.
So what I've been doing since that time, I took a little bit of time off. I know you did too, before we started working. So I just basically chilled because it's been 2 years of craziness. I had the opportunity to go down to Boston and hang out with Zach and Steph and the amazing crew at Boston PT Wellness, which was unreal. And then I started a job. So I started working at a clinic in London, Ontario, PT Health, Old North Physiotherapy, with the one and only Hannah Moves. He's the other physical therapist there. Got to shout out Nick. That'll hopefully get us a couple followers. So yeah, I started practicing there 2 times a week, and I've probably been there for going on 3, maybe 4 weeks now. And yeah, it's been interesting. I'm sure you can attest to that because I know you were doing your own thing. So why don't you let everyone know how your journey has been since graduation?
Well, I feel like it's like a weird purgatory for physio grads when they graduate, because you're in this weird kind of transition period where you have to try to find a job, unless like I think a lot of people have kind of during their kind of last couple of terms are maybe connecting with some people where they might already have a job lined up. But for myself, I wasn't totally hooked up yet, you know, having to go back home after school. So you're trying to look for jobs at the same time knowing you have to start prepping for the national exam, which is tricky, you know, because you have to, that's really the focus, because you have to pass that in order to keep being a physio. But you want to start making money because you just came out of grad school.
And you're broke.
So it's this kind of weird, like, so that's kind of how I felt. I felt like there's a lot of pressure to try to find a job and at the same time focus enough on trying to pass that dang exam.
Yeah.
Right? So I feel like you probably felt similarly, and I think that's something that I think, you know, people who are going to graduate PT school can kind of realize is everybody goes through this weird transition phase, and it is stressful, but, you know, we all go through it kind of thing.
Yeah, it gives you that, you still feel uncertain. You don't even feel like, I'm going every day like practicing as like a physical therapist, but like I don't feel like it 100% yet, because there's like this one more like milestone that you have to pass, and if you don't, then it messes you up pretty good. Like you have to stop working, right? So that it's just like an uncomfortable feeling, and I feel like it doesn't necessarily allow you to feel completely comfortable as in your role.
But given that, like, what we both kind of did is we both aren't working totally full time,
right? Yeah.
So we have like a little bit extra time on the side to just study, and I think maybe that's like a good option for people who are just graduating, at least in Canada, you know, is to like, you know, start working so that you can start getting experience and getting comfortable, but then having like also some time at the start to focus on passing that exam. Yeah. But yeah, we've both kind of done that. But yeah, I mean, I started, I have 2 jobs I'm split between, and they're both private practice, and so I've been working there 4 days a week, and yeah, I mean, it's definitely a fun, weird experience starting. It's challenging, you know. Yeah. What's it been like just kind of starting? What was your first couple days like, you know, starting as a physio resident?
For me, it was like, honestly, I'll be honest. It's good that like I didn't go into a crazy caseload. Like my caseload's been pretty slow, which is cool because it's a lot. It's pretty overwhelming. Like that first person that walks in and you're like, okay, it's game time. Like it's just me. It's all on me. I got no one else to fall back on. You can't pull a student card, you know?
Well, that's the weird thing. Do you get, you know, it's this weird feeling where you're immediately regarded as a physio. It's not even like, there's no transition period where people are kind of like, oh, you know, you're a student, like, you're right away, first person you see, like, it's on you.
Yeah, which honestly, in a way is like, is good. Mm-hmm. I think it's like, it's nerve-wracking, but at the same time, and I know me and you've talked about this a lot, and you've talked about it on a podcast about like having CIs and having other people that are looking over your shoulder and giving you feedback, which is good. You need that. You need to learn from people, but also it's now you. Like you've been educated, you've learned, and now you're able to take your skills, what you feel is valuable to a treatment session, the way that you want to treat, and put that into practice. Yeah. And I think that is awesome, and that's probably been by far the most fun that I've had. Because you're in control. Like you're the one that gets to educate the patient on what you think they need to be educated on or what they want to be educated on. You can choose the way that you're going to provide care. Whereas as a student, and I'm sure other students can attest to this, is like you don't feel that full control.
Yeah.
Because either you're jumping into a caseload or you're meeting someone for the first time, like, and they've already been treated by the other physio, or even if you get a new patient, you kind of the way you treat is guided by the way that the CI that's watching over your shoulder kind of treats, and you don't necessarily feel yourself.
You might get like a weird look too, like if you're trying to use some analogy that you've learned about, and maybe your clinical instructor's not so down for that analogy, you're kind of getting these weird looks and you don't feel totally confident.
Yeah.
And then the education comes out weird. Whereas if you're just on your own, you can try these things and you can see what works with what people. I think that's been really fun the last few weeks, is just kind of getting to actually fully experiment with some of those things.
Yeah, you definitely start to get in your own groove and you feel like your own person almost, and it's good. Like, I mean, the environment that I have, like Nick being the other physio there, like he's able to help me a lot too. So it's not like I'm completely out on my own. And like, what I would say for people that are looking for a new job, or if there's physios, like new grads out there that just got out of school, like, don't rush into a job if you don't have to, and really try to search out for a clinic or if there's another physio there that aligns with what you're trying to do.
Yeah, I was actually going to mention that, because I think that was some advice that we've gotten, like whether it's been through the podcast or through just like conversations we've had with some people that we kind of look up to, is the biggest thing has been like advice towards finding people that you want to work with.
Yeah.
Rather than just focusing on like your contract or your money that you're going to make, because it is extremely difficult. Like the world of PT is so gray.
Oh, man.
And there's always stuff that you want to kind of bounce off. And I know that's been great for me these last few weeks, is my boss is like, and my supervisor is like very willing to discuss like clinical cases and stuff, and just like, he'll give me resources, or we'll just chat about things. And I know it's the same with you, and that's been big, because with you hanging out with Nick and stuff, like when you guys talk, we end up talking about it, and it ends up making both of us better. So I feel like that's been super huge for us, is just trying to focus on finding like good people to work with.
Yeah, I think it's the most important thing.
Yeah.
And I get like financially sometimes, like you have to make decisions, like you have a lot of debt, like you need to start working a full caseload, like obviously, like you got to do what you got to do. But if you can, like, I would say doing that is probably by far, like, since I've started, was the best thing that I've done. Because it has like taken a little bit of pressure off you in a way, because you have someone that understands somewhat of the way that you're thinking. And so like if you have a question, they're going to answer it in a way that you'll understand and implement into your practice. You know what I mean? So I think that's been a huge key. But it's been a struggle, man. Like it's different than being on placement, and it's the same in some ways, but it's hard. Like you're sitting down with this person and you're listening to their story, and you're trying to figure out what you can do for them, or what you guys can work together to come up with a plan. And sometimes you don't necessarily know 100%, and it's hard to come to terms with that at times. And you can just, maybe if you don't day one figure it all out, if that's okay, you have more time with this person. I think both of us have realized so far in the short time that we've been out, like as actual physical therapists, that just listening to the person and building a relationship with them on that first day is probably one of the most important things. Yeah,
true. I think like one of the best things that we've learned from doing the podcast and from like just chatting with people who are physical therapists and stuff is learning how important like communication is, like even just simple things like active listening. that has saved my ass, like, starting. If I didn't know some of that stuff, you know, I could have been that guy interrupting patients, and like just not like just hearing people's story is so important, and like those little things, like pointing out the positives that somebody said, like just little kind of tricks like that, you know, or asking people what they expect from physio.
Yeah.
You know, writing things down on the whiteboard, like just little like
hashtag whiteboard gang.
Yeah,
Zach.
Yeah, Zach, and I know Zach and some other people do that. Nick probably does it sometimes.
Yeah.
And like that for me, like I just start writing things down on the whiteboard, and like when people at the end of the session, they can take a picture of it and take it home.
Yeah.
And it gives them something to kind of look at as a reference, and also to like kind of keep those key points going forward. Like just little things like that have been the most important, most valuable like things I feel like we've learned over the last year.
Yeah, you know? I would definitely agree with that, and I would also say like listening, like active listening, is something that is hard, and I extremely like struggle with that still. And like it's funny because you even know like that's important, and I go into an assessment or even like a follow up with the idea of okay, like I'm gonna listen to this person. I'm gonna try to sit there and not like think about what my next question is gonna be, or like really try to be present. It's way harder than it seems, and I think it's gonna take time for me personally anyway to like get good at it.
Yeah.
Because, and I think it's hard for students. I mean, I would like to hear from other like physios, and we kind of talked to Jared about it on our last podcast. But like, it takes time to develop it, because I think as a student coming out, you're thinking about so many different things, and you're worried about like, okay, like does this person like believe that I'm like, you know what I'm talking about? You know, am I actually doing something that's valuable to them? What am I going to do next? Like, if they don't respond to this, like, how am I going to modify it? Like, those are things that like go through my head at the time. And I think that's just a lack of maybe experience so far, or maybe a little bit of lack of confidence on my part. And so then that affects my listening, because I'm thinking about these things instead of necessarily zoning in and just being present on the person.
Yeah.
And from what I've heard from like people we've talked to, is that you have to just do that. Like if you just focus on the present, what you're going to get out of that is going to probably far outweigh than what you're thinking about, like that modification for that exercise,
right? Or
that the next thing you're going to do in your treatment, or the next thing you're going to educate that person on. It's more important to just be extremely 100% present in listening to what they say. And I'm trying to do that. It's hard, man. I don't know if you've experienced that. I mean, I think you're a better listener than I am in general. Overall, just knowing you and like
how
being
ironic.
with you for the last
for those who don't know, the reason that's funny is because I wear hearing aids. I'm actually hearing impaired.
Oh,
so, but you know,
maybe I should get a pair. I mean,
I would say though that I still do struggle, you know, and I think that is probably the hardest part, is just trying to slow things down, and like trying to realize that as long as you cover, you know, some like the red flags, and you're kind of like remaining vigilant for that type of stuff, and you're, I mean, going through an assessment, the exact special tests and stuff don't always like matter so much. You can kind of you can bring one back of later in a treatment, you know. Things don't all have to get done day one. So I feel like, you know, us just trying to focus on slowing things down and not trying to put so much pressure to get everything done on day one. I think that's going to be easier said than done, but I think that will probably be something that will help us both going forward, eh?
No, 100%. I agree. And I think it's something that we've talked about it before, but like, I feel like I've already started to accept a little bit more, is that like you're not going to get everything done on day one, and that's okay. And I think that comes back to why it's so important to actually listen and build a therapeutic alliance with that person, so that when, you know, you come back in on that second day, like you're ready to go. Like that follow up, like, okay, you've established somewhat of a relationship with this person if it goes well, and then you can come in on point with what you want to do. And something I've tried to do going, because I've had a little bit of extra time in terms of like not working full time and not having a full caseload, is really take the time to think about the people that I do have, and come up with a plan for them, like going into that day. And I'll write it out like beforehand, like on a sticky note.
Yeah.
And I'll bring it in, and then I'll take that sticky note out like during the session, and I'll either write it on the whiteboard or I'll just have it out. And I don't know if it makes a difference or not, but like some people might see that and be like, oh, okay, like this guy's, you know, he actually is putting time in to like think about our session, you know, and think about what we're doing.
It's a good idea.
And I mean, I haven't gotten feedback from the person if it makes a difference or not, but it's something, one, it helps me prepare, and two, it can help show people that, you know, like you actually care about them and that you're working to help them out. So that's something I've done, that I found to help me and hopefully helps other people.
What's been the most like rewarding thing that's happened so far, as far as like helping people?
For me, I think so. I've been, again, I haven't been that long working, but the one thing this just happened the other day actually is the first person I saw, he had some low back problems, just non-specific, you know, and he came back and he was super worried about it, and I've been seeing him for a couple weeks now, and he came back to me last session and he was super fired up because he was able to get through a whole class. Like he was having problems sitting in class and because of his back pain, and he had to leave class, and he really enjoys his class. Like he enjoys being there, and he had to leave a couple times from that class. So, you know, we talked, I gave him some strategies, or we worked out some strategies together that he could help, like that he could use, and he started implementing them, and it started to help him. And he came back to me the other day and was like, man, I was able to sit through my whole class. You know, I did have a little bit of discomfort, but it was fine. It didn't stop me from doing that. And then he's like, I was able to go after that and go out with my friends, and sit and play like board games for like 4 hours, which like sitting for even an hour at a time in class would be really tough for him. And he was able to like stay throughout that whole time with his friends. He said, oh, you know, like I got a little bit of like pain, like some uncomfortable feeling in my low back, but you know, I used some of the strategies that you gave me, and I was able to stay throughout that whole session. I didn't think about leaving once. And I was just awesome. Boom, I'm like, that fired me up because like that's cool. Like that dude was able to do what he wanted to do and didn't have to leave. And he was super pumped about it, right? Like he came back and he was fired up. I'm like, that's awesome.
Yeah.
You know, and he did it. It wasn't me. Like he's the one that's using the strategies, and he was even comfortable enough with saying like, hey, like let's go. Like I'm happy to do this session. But what do you think about me coming back in 2 weeks instead of coming back next week? And I was like, yeah, man, like let's do it. Like you have the strategies, and like, you know, if we'll reevaluate in 2 weeks and we'll see how you're doing. Mm-hmm. But like that for me has been like one of the most rewarding things so far. And it's cool because I've shadowed other people and I've talked to other people and telling stories about like things like that. Mm-hmm. But then actually being able to like experience it is cool. Like it's in a way it's rewarding in the sense of like that's kind of why you got into like this profession, and to have it pay off a little bit,
right?
Or at least to see positive results is cool.
I think that's cool. It shows like that you really value your coaching, you know, yourself as a coach. Yeah,
and I value, for sure. And that's kind of what that's what I think the movement in physiotherapy is going towards. But like we're giving these people strategies, like we're facilitating it for them. Like we want them to take control of their own life,
exactly,
and have the power to manage these things, because realistically everyone goes through something like that. You know what I mean? Like we all experience pain. Like just because me and you are a physio doesn't mean that we're just exempt from experiencing back pain or like hip pain. Like we've all been through like our own things, and we're still managing things, right? Daily. But that's just that's how it goes, you know. So like being able to like coach or help or facilitate people to be like, oh man, like I hurt, like my back's a little sensitive because I did this the other day, but like I'm cool because I know that I can manage this and that it's not the end of the world. Mm-hmm. Man, that's awesome. Like that's the way it should be, and that's like my goal, and I know it's your goal to like to continue to do that for people.
Yeah. No, I think the coolest thing I had actually was at the end of an assessment, I had written some kind of stuff on the whiteboard, and it was like, just simple things like, pain's more like an alarm, more like a sensitivity, and that type of thing. And I had the person actually after the session kind of just looked at me and was like, so, because I asked, what questions do you have? And she said, which is a tip I got from Jared from last podcast, which is has actually helped so much. Instead of asking, do you have any questions? Ask, what questions do you have? Because people always have questions. And when I did that, she basically said, so what you're saying is like, just because something hurts doesn't mean it's actually harmed me. And I was like, whoa, yes.
Just dabs, like just hardcore dabs.
I got super pumped, so that was
awesome,
super
man.
Awesome.
Yeah. Yeah, no, and that thing about what you said with Jared, I think you told me that, and like I started being more aware of it the next time I went in, and I did the same thing. Instead of saying like, do you have any questions? Like, what questions do you have? And the person automatically like fired off questions. Yeah. You know what I mean? And you'd have to see over time if it makes a difference, but I think it does because it said, do you have any? It's like, what? Like, what one? Like, I know you have some. Like, what is it that you want to ask me? And maybe they don't. And if they don't, they'll just be like, no, I'm all good. But like, it definitely made a difference for me too when I started asking it.
For sure. Because I actually did. I've had a couple times where I'll say, do you have any questions? And then I'll actually switch it. And they'll say originally no, and then I'll say, what questions do you have? And they'll actually have questions. So there's something about asking it that way that just, it's more open-ended, I guess.
Yeah.
Yeah. I don't know, but
Jared has all the tricks. Yeah, no, for sure. I mean, it's been fun. It's been stressful.
Yeah. Definitely
but,
stressful.
I'm looking forward to continuing to like develop. Obviously, like it's only been 3 weeks, but it's definitely exciting. And for anyone that's in school that's like struggling, like, and you're like, am I ever gonna get there? Like, you're gonna get there, like, and it's worth it. Like, it's definitely 100% worth like the hours that you put in school, like, the money, the stress, like it all does pay off. Like when you actually get there and you get to start being the physical therapist you want to be and helping people, like 100%.
And if you go in with that mindset, then you can't lose. No,
for sure. Yeah, so, I mean, we've been talking for half an hour now, and I don't even remember where we started, but let's talk a little bit about where we want to go with the podcast. Like, I think something that me and Will have really found valuable is, like, having these kind of conversations with each other. Like, weekly, like, we'll call each other and just talk about, like, what went on in the clinic, some people that we saw, some experiences that we had, some mistakes that we've made, more mistakes probably than things that went well, but we'll talk about the things that go well. We'll talk about some of the strategies we've learned from like our supervisors or other physios that have really helped us over the last couple weeks. So I think what we want to do is we want to bring in another segment like to our podcast around that. We're not exactly sure like what we want to call it yet. But it's gonna be shorter, and it's gonna be at times it's gonna be just Will or it's gonna be just me, and then sometimes it's gonna be
like another
new grad,
even maybe students. We'll see.
Yeah, and just kind of talking about these things, like these struggles that they're going through, some of the things that they found to be helpful.
Kind of like brainstorming strategies.
Yeah, and it can even be talking about specific cases that they're struggling with. I mean, bouncing ideas off of each other, me and Will doing that has helped us out a lot. And I've talked to some other people that have like reached out and are just like, oh, I'm really like struggling with this, or like and they don't really have anyone else to like talk to. So I think this will be a good avenue to go down to provide some insight to people.
Yeah, and like we encourage people to reach out with like their struggles or questions. Like if you're a student or like a new grad and you're struggling with something, like you want to like chat about it, like brainstorm some stuff or whatever. Or like if older, like more experienced clinicians want to reach out and like have some tips, like just
Yeah.
fire them our way.
Yeah, for sure. I think we can reach like a lot of people that need some help, and like you can always learn something new from a conversation. That's something that we've learned over the last year,
especially when it's over coffee.
Exactly. So yeah, I think we're gonna launch that sometime over the next couple weeks. We don't know exactly when yet, but it's gonna be separate from these episodes. We're gonna have a little cool name to it. Come up with maybe a new intro for the podcast. You don't have to listen to me saying "Welcome to the PT CoffeeCast." And yeah, I think it'll be fun. We're looking forward to it, and I think we're gonna start maybe recording them and posting them on our IG live, our IGTV. Just another way that you guys can consume the episodes. So I think, you got anything else to say, Will? Or?
No, I'm good. That was fun. It was a good conversation.
Yeah.
It's nice to see you again, man.
Yeah, I know. It's great. It's great to be in the flesh. Yeah, so that's all we got for today, guys. We'll be back at it next week with another interview. And over the next couple of weeks, I think we'll have some interviews lined up that we're pretty excited about. So stay tuned for those. You guys know where you can find us. You can find us on Instagram, Twitter, at the MVMTPTs, geez, and on Facebook as well. If you guys want to email us at the Movement PTs with any questions, concerns, or anything like that, don't hesitate to reach out. And one other thing, guys, we want to try to get some more love on our podcast reviews. So if you guys could do us a favor and head over to iTunes and drop us a rating, drop us a review, like we'd really appreciate it. It's just helps our podcast like move up the lists on iTunes and hopefully start to grow more so we can continue to deliver like good content for you guys. Other than that, guys, we hope you enjoyed this episode. We hope you enjoyed your coffee, and we'll see you next time.
Cheers.
Peace.